Anushka, take it.
Okay. Can I start now?
Yes.
Okay. Good evening, ladies and gentlemen. Today we are here to discuss about COVID precautions and vaccination awareness. Before starting this presentation, can I please know, just unmute your mic and speak. Can I please know if anyone among us has been COVID positive or had a family member who was COVID positive?
Luckily, I was not in touch. I'm safe.
All right. So we all are among the lucky ones. Okay. So what I was gonna tell you is, like, we have a few precautions which we can take. Not many people know about these, or if they know, they're not properly following these. Okay. So I'm gonna tell you about them in little like details. So first of all, we have double masking, then we have sanitization, vaccination, and if God forbid someone is positive in our household or among our close ones, how to care for them. Double masking, I would like to really elaborate on this because this is like something important. First of all, you should know how efficient the mask you're using is. Mostly masks which I can see around are surgical masks, and then we have these cloth masks that are DIY. And then we have N95, of course. These other masks you can see on the screen. You can even take a screenshot for sharing it with your friends. Or so the cloth mask which we are currently using honestly does not really provide that much protection against the virus, but it does somehow protect us from other causative agents. Okay. And the sponge masks, please don't use them, please don't buy them. It's a waste of money, it's a waste of time. You're just fooling yourself, so don't go for it. N95 is the gold standard. It doesn't need any double masking or any other mask with N95. You have to use N95 alone because it seals your face, and it blocks 95% bacteria, virus, everything. Surgical masks, if you are using it properly, then it is highly efficient. When I say using properly, I'm going to tell you about it in a bit. It is like we are using a surgical mask, we are wearing it on our nose like this, not properly covering the whole face. We're having holes on the side. That doesn't solve the purpose. So now I'm going to tell you about wearing the mask properly. So there are two ways of increasing the efficiency of the face mask which you're wearing. First is knot in tuck technique. You can see it on your screens. And the second is double masking. The knot and tuck technique is for when we wear a mask. Our masks are in rectangular shape, most of. So when we use it to cover our face, sometimes we have a little hole and the air is seeping inside. It doesn't really serve the purpose of filtering it out. So knot and tuck technique is we knot the corner of the mask close to the edge and then wear it. And then you can like tuck these three plates of the mask on the inside, so there's no gap. You can see it on your screens right now. And the next we have is double masking. Double masking is wearing two masks, of course, but you can't layer two cloth masks or two surgical masks. Double masking is just putting a surgical mask first and then covering it up with a cloth mask. It increases the efficiency of masks. And you just please don't put two surgical masks together or two cloth masks together. Two cloth masks together, it will just increase bulk of on your face, It would be uncomfortable, and 2 surgical masks would ultimately cause suffocation. So please don't try to do that. And you don't have to do a double masking if you're wearing a N95 mask properly. These are, 56.1% is the efficiency of an unknotted surgical mask. And if you knot it properly, it filters about 77% of the particulate matter present in the air. Same is with a cloth mask. Cloth mask, blocks 50%, 50 approximately percent of dirt, pollen, bacteria. But if you pair it up with a surgical mask, the efficiency increases to around 85%. Okay, next is the hot debate, Covishield versus Covaxin. Which vaccine you should take, which is harmful, which is beneficial for you. Right now, vaccination is going on for 18 plus people. So let me just tell you, both the vaccines are same. They have mild side effects such as you can experience fever. You can take a paracetamol for that. If you have an allergic local reaction, okay, when you go for the vaccination, they'll ask you to sit for around 30 minutes to analyze if you're having an anaphylactic shock, means allergic reaction to the vaccine. If you don't have a reaction within 30 minutes, you are safe. You won't have a very massive reaction to the vaccine or an allergic reaction. You might experience a mild fever, headache, or weakness, and or a mild flu, but that's that. You will only get these type of effects. You will not be getting COVID positive because of taking the vaccine. Difference between both of them is Covishield has inactivated COVID virus. Inactivated means it cannot harm your body, it just triggers your immune system. And Covaxin essentially has a virus which causes flu in chimpanzees, adenovirus, and they produce a spike protein in our body which is similar to COVID. So our body initiates its response and produces antibodies for COVID also. So these are the two vaccines currently available in India. And now we are having, Sputnik vaccine from Russia. It is a whole different story. If you want to know about it, we can talk about it. Then patient care, and after you have taken the vaccination, you need to be careful for a few days. Please don't stop wearing masks, or please don't start going outside just because you got vaccinated. Take both the doses of vaccine, and please make sure if you're taking Covishield as the first dose, please get the second dose of Covishield only. Don't mix them because then it won't work. And patient care, if someone in your family, God forbid, is positive, get the whole family tested. Keep that person in isolation. You can provide food for them while wearing a mask. There are drugs available for care. Consult a doctor. Mostly they'll prescribe doxycycline or azithromycin. And keep taking vitamin C. That is essential. After you have recovered from COVID, it will, cause lot of weakness. Please take care of yourself and your loved ones, and if you can, please donate plasma. That's all from my side. If any of you has any doubt about anything I discussed or something else related to it, you can ask now.
So basically, Anushka, that was literally a great explanation, and I love the Covishield versus Covaxin part. That's literally the hot debate in the mind.
Yeah, it is, because most people don't know the difference between two of them. It's if I explain you in like simple words, a vaccine is like a postman. They're literally carrying a message into your body. So it has Covishield has a capsule of COVID virus. Okay, so our we recognize the postman. Oh, ये तो अपनी जान पहचान का है, and let them in, and then start producing antibodies कि अरे ये अंकल हमारी जान पहचान के हैं, इन्हें तो चाय पसंद है, so let's give him चाय. So our body will start producing antibodies for that only, because it is inactivated virus, so it won't harm you. And Covaxin does not have COVID virus. It has a virus, adenovirus. And adenovirus is mutated genetically to produce effect same as antibodies which produce the same effect as COVID. So these are two vaccines, and the gap between vaccination, I would like to tell you something interesting right now. The gap was increased. If someone knows recently, how much gap is prescribed between two doses, if any of you knows?
12 week.
Yeah, that's right. And earlier what it was?
It was 4.
Yes. So what happened was, when you take the first dose of the vaccination, our body is preparing antibodies against the capsule covering of the virus. Okay. So if you take the first dose, now our body is immune. Now our immune system is, well equipped कि अब अगर ये वाला प्रोटीन हमारी बॉडी में आएगा तो we'll fight it. तो इसलिए अगर सेकेंड डोज हम जल्दी लगा देते हैं तो आवर बॉडी ऑलरेडी हैज एन ऑटोमेटिक रिस्पॉन्स फॉर दैट प्रोटीन, तो वो अंदर आते ही हमारी बॉडी उसे रिजेक्ट कर देगी. So that's why you have to like wait for a few more weeks so that our primary response kind of dulls down. और उसके बाद जब आप सेकेंड डोज ले रहे हो so that second dose is more effective, because now our immune system won't reject it completely, it will accept it and then produce the antibodies. The Russian vaccine Sputnik has solved this issue. They have solved it how? They will use different carriers for two doses. The first dose will have a different carrier, different postman, and the second dose will have a different postman. So they don't have to have a large gap between two doses. That's what is going to happen. If anyone else has any doubt, we can discuss it.
This one was really amazing. I literally used to wonder that, why this gap is increasing. And honestly saying, at first point, I thought that is just a step due to, the scarcity of vaccines. That's good.
Yeah, that's what mostly people are believing, that it is because of scarcity of vaccines. It might be a factor, but our immune response is, a primary concern about. So I think that's it from my side.